I think one of the things that's been really great about the partnerships that have emerged is I think we have shared purpose that's clear. And the shared purpose is, I love the way the Behavioral Health Leadership Coalition says it, to build a system of care that serves the whole person, their whole life, so they can realize their full potential. Build an integrated system of care that helps people to move from crisis and illness as a norm to recovery and prevention as a practice. What the heck does that mean? It means medical and behavioral health working together. It means law enforcement, EMS, and behavioral health specialists working together. It means real integration so that we can wrap around a person who has complex needs and complex challenges and get them the care that they need. What are 3 things you need to do to make that happen? You need to get upstream and prioritize prevention. You need to promote integration across the system of care. And then the 3rd piece is to improve access to care so that people don't have to wait to get in and to meet with the providers that can really help them to move to the next right place. The most important thing for the long-term health of our community is to prioritize prevention. Reduce risk factors that young people face and promote protective factors, meaning setting people up for success, helping them to sort of be in the best position so they can thrive in this world. So that means helping young people to make good choices around substance use. That means education and helping them to understand the consequences of getting involved with things that can undermine their success. Engage Douglas County is a group of people, a coalition that's dedicated to prioritizing prevention. And what they're really focused on is setting up those protective factors, reducing risk factors with young people. Their tagline is engaged adults, thriving youth. And the idea is, how do we build those connections between the adults in our world and the young people in our world to really partner together to set young people up to thrive? So all of the school districts in Douglas County are partnering with law enforcement agencies on a project called Handle with Care. Handle with Care gives a heads up to school officials after a young person has had contact with a situation that might have been traumatic, might have make it difficult to cope the next day. So it's a quick little notification that this young person needs attention, compassion, and support. All of our police chiefs and the sheriff have committed to training people in crisis intervention training. And that gives law enforcement tools to de-escalate the situation. It gives them an opportunity to learn from people who have lived experience with mental illness, with addiction, so they can show up and be on site in a compassionate, helpful way. We have peers at the heart of all the work that we're doing. And so they can work with people in a way that says, hey, I've been there before, I understand what you're going through. And so that lived experience perspective is the thing that can make the difference between a person saying, yes, I'd like to take the next step, or no, I don't trust the system. One of the things we know about the challenges that a person who is moving through recovery experiences is if they don't have a safe, affordable place to live, it's going to be that much harder for them to maintain the recovery. And so we are involved in a series of initiatives to improve and expand the amount of supportive housing in our community. That can be permanent supportive housing, like the cottages at the Treatment and Recovery campus of Douglas County. That can be programs like Transitions and Artists Helping the Homeless and Oxford Houses that provide that temporary housing as a person's getting back on their feet and moving into the community. You can now access a system of care that will get you the help you need 24 hours a day, 7 days a week. How do you access that system? You pick up the phone and you dial 988, you dial 841-2345 if you want to make sure that you talk to somebody local. And that call takes you to an air traffic control system that finds and connects you with exactly what you need. It might be a mobile response, so a mobile team that will come to you, try to figure out what's going on, figure out if there are resources, so we can keep you at home, we can keep you at the community. If things are really a little bit more escalated, then you turn to the Treatment and Recovery campus. You can just walk in 24 hours a day, 7 days a week, and there will be behavioral health specialists, people who have experience with and knowledge about substance use and addiction, people that can keep you safe, The best thing you can do when somebody's in a mental health crisis, somebody you love is in a situation that you think is really not ideal, is dangerous, is don't be afraid to reach out. So it is perfectly okay not to be okay. And here in Douglas County, we have a lot of resources to get people the help they need and to provide the right care in the right place at the right time.